There is a shortage of injectable contraceptives in South African public health facilities. This is according to the Stop Stockout project, which monitors and reports on the shortage of medical supplies nationwide at public healthcare facilities. Their survey has found that injectable contraception has been the hardest hit by stockouts in the public health system over the past months. Of those who said they had not got the type of medicine they needed, 40% of them said it was contraceptives, and more than 76% of those said it was the injectable contraceptive. We're now joined by Khadijah Jamaloodien, who is a director from Affordable Medicines. Good to have you on the program. Thanks very, very much for joining us, Khadijah.
Thank you. Thank you for having me.
So, Khadijah, in terms of what you know, I know we were meant to be joined by the Department of Health that were going to talk to us about this, but clearly that interview is not happening. Unfortunately, I see that you are our guest that's now going to be speaking about this. So I'll have to sort of imagine where this interview is going to go, because I can't really hold you accountable for the fact that there aren't enough of these products. But you obviously work in this environment.
Sorry, Leanne?
Yeah.
Sorry, I am from the Department of Health.
Oh, fantastic. I'm so
the
glad.
Director of Affordable Medicines in the National Department.
So you are with the Department of Health. I'm so glad. I'm so grateful. But they've got you as titled something else. So I'm glad that you've sorted that out and cleared it for us. So now I can speak to you in the angle I want to. Can you confirm that the country has been experiencing a shortage of injectable contraceptives?
Yes, indeed. I can confirm that there has been a shortage. And the shortage and the supply constraints that led to the shortage preceded the COVID-19 pandemic. So it's not a new development. What I can also say is that at present, that all those supply constraints that we experienced during the time that the study was done has now been resolved. So there was a shortage of all injectable contraceptives before COVID-19 pandemic, during the pandemic, and indeed, during the time in which the study was conducted, but that study was done between April and June, and we are on the first day of September. Happy Spring Day, everybody. And I can confirm that the supply of those contraceptives has stabilized.
Yeah, I know you say a happy spring day, but I don't think it's a happy spring day for a lot of people who go to these medical facilities, and I imagine they still will go to those facilities and not find what they're looking for. How did this happen?
Okay, so if you look at injectable contraceptives, we have two registered products in the country. The one is medroxyprogesterone, which people know as Depo-Provera, and the other one is northisterone, which people know as Noesterate. So for both of those products, there's only one supplier in the country, and those products are imported. So oftentimes, companies will make business decisions which will impact on the availability of the medicines. So the Depo-Provera is manufactured, for example, by Pfizer. And you know that Pfizer has been involved with the COVID-19 vaccine production. So it's a business decision which people make to prioritize, manufacture of one product over another. So that led to some of the supply issues that we experienced with the Depo-Provera. But obviously, this problem preceded the vaccine production of that, and it had to do with active pharmaceutical ingredients being available globally, and manufacturing sites not being approved by the regulator. So there are a number of things that led to the Depo-Provera not being available. Also, with the northisterone, which is Noesterate, similar problems. You have regulatory issues, the demand for a product. So what also happens is, if you have one product and you don't have the other, the demand then is driven for the product that is available, which ultimately leads to a shortage.
Yeah.
So there is supply and demand. There are supply and demand issues. So with the northisterone, because the demand was so high, the supply couldn't keep up with that demand, and so it ultimately led to a shortage. And that impacts on all the contraceptives, because we do offer a range of contraceptives, including the subdermal implants, the hormonal tablets, intrauterine devices. So the minute you don't have one type of contraceptive available, it does drive the demand for the others, and you can't predict the direction of demand, and so you can't plan accordingly. So it was a dicey situation, so we tried to manage as best we could. What we also did, Leanne, and I'm sure that's going to be your next question, is what did we do? So what we did was we looked globally for other suppliers of the particular product. Although it's not registered in the country, we did get our regulator to approve the use of this product. So we brought in about 5 to 10 million units of the products into the country for use, make it available until our contracted supplier could stabilize their supply.
Yeah, okay. So let's talk about this now, because many people are talking to the fact that when they go to these health facilities, wherever they are, the public health facilities, they are then given something else to take. And if you don't have that, if you don't have the injection, then they give you a pill. And if they don't have that pill, then they move you on to another pill. And you and I both know that that is not the way things are done. It's not ideal, but to a person and a woman's health and what that can do to you is devastating. Now, what the complaints coming through are also, there is no communication from the health department to these different clinics and facilities as to why there's a shortage. Nobody knows why. And so they have no option but to just hand out things and change people's pill every month. That can't happen.
Yeah, so the communication as far as shortages and that is concerned has always been a concern for us. And, you know, we don't do things in isolation at the National Department of Health. We do have our provincial colleagues who are also part of the team that looks for solutions and try to mitigate the negative impact of not having medicines available. So we had communicated that to the facilities. I think, you know, where we require improvement in how we do things is our communication, and I accept that criticism and that as a failing on our side. We have developed we are in the process of developing a communication strategy to assist patients, to assist prescribers when there is a shortage of a particular medicine. We have on our website, information about what leads to a shortage, and we publish what's known as our hot list on the Department of Health website, which tells you which items are, on our radar, which can possibly lead to a shortage at a facility level. But obviously, we need more structured, more focused communication with our facilities.
Yeah, well, that goes without say, because at the end of the day, the people that are bearing the brunt of this lack of communication, the lack of medical supplies, and I mean this is just one of many things and medical supplies that are missing. I mean, that are low in stock. I mean, we could move on to issues of HIV treatment, because there've been complaints that there's also a severe lack when it comes to the treatment of HIV and taking the medication for that, also TB medication, pregnancy tests. It doesn't end at just the contraceptive issue, which is our focus particularly now, but what is going on? What is hampering the supply of medication that South Africans deserve? This is what the Constitution says. They deserve these medicines.
100%, Leanne. I just want to make a correction. We've had no shortages of ARVs. In fact, even during the COVID pandemic, despite global supply chain disruptions, our first-line ARV availability was at 97%. So if it is a shortage at a facility, it's not a national, it's not a national problem. It's a facility-level problem, which the district and the province, which then needs to resolve. So just a correction on that.
Yeah, it's a study I'm reading where it's basically saying to this research that we're talking about, to the survey, it indicates that other commonly reported medicine stockouts include HIV medication at 16%, pregnancy tests at 10%. So I don't know where they get their numbers from then.
Yeah, we will have to interrogate those numbers, because our data gives us it's telling us that we are at 97%. In actual fact, we have suppliers who are sitting on stock that they are unable to move, because in anticipation of the global supply chain disruptions, we brought stock into the country to make sure that particularly the vulnerable population, such as our HIV population, on first-line ARVs in particular, would have access to stock. So that would be a facility level issue, which would require us to go to each facility and investigate what is the root cause for that report. But I can assure you from our level, ARV is not a problem.
So, Khadijah, I mean, I have to ask you this question. Why do we have to wait to hear it from an organization that monitors and then reports back on medical stock supplies? Why are you as a department, we spoke about the communication with the different clinics and health facilities, and that's a very bad point from the department, which you admitted to. You need to improve that. But perhaps you need to improve in general your communication with South Africa at large. Why do we not hear it from you that there is a shortage? You've known there's a shortage. Why do we not get this directly from the department to say, listen, South Africa, we have a problem, we're trying to fix it, this is the reason why, but in the meantime, this is how we're going to assist you?
I think, Leanne, that's a very complicated an answer to that is very complicated because obviously my job is to look after the medicine supply chain. And communication is not my strong point, as you would have noticed. But I think in terms of communication, why, when we do the back end, when we do the interventions that will try and mitigate for the stockouts, we're so focused on making sure we resolve the problem. And we try as far as possible to get the medicine to the patients because obviously our patient experience is what counts at the end of the day. That we don't really focus on how do we communicate that except to our peers who we expect would communicate it down to the facility level. I admit there is a communication issue. Which we will take up with our communication folk in the department as well. The other thing we don't want to do is create a panic and anxiety to say this is a problem, and people then panic and think, oh no, we're not going to get medicines, etc. So there's a balance to be had.
But Khadijah, they're not getting medicines. They're not getting it. So it's not causing panic. It's the reality on the ground, and the communication may assist expectations. When you arrive at a clinic and you find out that they don't have this injection for you, then they're going to put you onto another tablet, and then perhaps another tablet, or nothing at all. And then what happens is unwanted pregnancies. Unfortunately, abortion, which is legal in South Africa, is another issue which we could talk about, but I'm not going to go there with you. But this is what lands up happening, and then we lose lives, and then we get young girls falling pregnant. We know what the problems are in South Africa, but the reality is that it is a right. It is a woman's right to choose what type of contraceptive works for them, and they need to have this kind of communication. So my quick questions to you. I know you sort of spoke to it right in the beginning, but when will these clinics now be stocked again with the injectable contraceptive? When will they be fully stocked and South African women are able to go there and get them?
So, Leanne, this study was done between April and June. As we speak, the data available to me says that the clinics have 97% availability. We have no supply constraints at the moment. It's all been stabilized. So if there are stockouts or reports of non-availability, there is an escalation protocol which can be followed within the facility, and they can report it to us as well. So I can give you an email address where people can send their reports of a stockout, and I can give you a telephone number as well.
That would be wonderful.
After the show.
Yeah, that would be wonderful. In fact, you can give it out if you'd like to give it out now, quickly, if you don't mind.
Okay, the email address is stockalert@health.gov.za. The telephone number, it's an 0800 number, and I don't know it offhand.
Okay, that's fine.
So I will share that later.
That you can give to us, but stockalert.
At
health.gov.za.
At health.gov.za.
Okay, all right. Khadijah, thank you. Thanks for coming on. Thanks for talking to us. Khadijah Jamaloodien is a director for affordable medicines, which is in the Department of Health. So we were going to be talking to Foster Mohale, who is the national spokesperson for the Department of Health, and then Khadijah stepping up and doing this interview for us. So we do appreciate her being with us. And according to Khadijah, fully stocked. All the clinics.
Well, 97%, would you say?
Yeah, have got. But I'd love to hear from our viewers if that in fact is the case.